Hi, this is David Comfort from Democracy Action Network. Here's what's actually wild. For 60 years, Medicaid has provided essential health care to millions of Americans without requiring them to prove their employment status. But now, thanks to the recently passed One Big Beautiful Bill Act, adults under 65 without dependents must prove they work at least 80 hours a month to keep their health coverage. This is honestly crazy, but not surprising, considering the historical context of work requirements in social safety nets. Ever notice how these changes seem to echo a narrative from a bygone era, where hard work was the only ticket to dignity? The truth is, 92% of Medicaid recipients are already working or engaged in caregiving, education, or are simply too ill to work. So why impose these new barriers? It's a classic case of punishing the vulnerable under the guise of promoting productivity. Imagine the logistical nightmare states will face trying to implement these work verification systems by December 31st, 2026. Experts predict a train wreck. How will people prove their employment? Does gig work count? What about those cleaning houses or mowing lawns where formal documentation is scarce? The system isn't equipped for this, and many will inevitably lose their coverage due to bureaucratic hurdles. What if I told you that similar work requirements have been tried before, with devastating results? Arkansas implemented a work requirement in 2018, and 18,000 people lost their Medicaid coverage without a significant boost in employment. It's clear that these policies don't work as intended. They simply create more obstacles for those who are already struggling. And let's talk about costs. The federal government has allocated a mere $200 million for all states to implement these work requirements, which is laughably insufficient. States like Kentucky estimated their administrative costs at over $271 million. This isn't just about healthcare, it's about the economic ripple effects, hospital closures, layoffs, and community destabilization. The absurdity doesn't stop with Medicaid. SNAP and housing assistance programs are next on the chopping block, with new work requirements looming. This is a systematic dismantling of the safety net that disproportionately affects the most vulnerable among us. So why do Republicans cling to this bootstraps rhetoric? Because it polls well, especially when they can paint a picture of welfare freeloaders. But once people understand that most recipients are working, support for these measures plummets. It's time we challenge this narrative and recognize that these policies are less about helping people and more about cutting essential services. Let's work together to understand these patterns and push back against the cruelty of these measures. After all, a healthy society is one that supports all its members, not just those deemed productive. Please like this video and subscribe to our channel. It would help out a lot. Peace.